What are the types of depression in pregnancy and the postnatal period? We distinguish between the baby blues, antenatal and postnatal depression. Short episodes of tiredness, nausea, aches and pains, irritability, sleep disturbance and loss of interest in sex are relatively common as part of the normal adjustment process in the perinatal period and will not require treatment. What about the baby blues? The term baby blues refers to a brief episode of mood swings, tearfulness, anxiety and difficulty in sleeping that is very common in the first week after the birth of a baby. It requires no special treatment unless the symptoms are severe. What about antenatal depression? Antenatal depression means depression that starts during pregnancy. Between 10 to 15% of pregnant women experience mood swings during pregnancy that last more than 2 weeks at a time and interfere with normal day-to-day functioning. Medical assessment is necessary in such circumstances. And what about postnatal depression, or PND? PND describes the more severe or prolonged symptoms of depression or clinical depression that last more than a week or two and interfere with the ability to function with normal routines on a daily basis, including caring for a baby. Around 1 in 7 women experience PND, and for around 40% of these women, the symptoms begin in pregnancy. It can be helpful to know that there are different types of PND. Why? Because not only can the symptoms vary between different types of depression, but they tend to respond best to different treatments. And 2 main types can be outlined. Firstly, melancholic depression. Melancholic depression is relatively uncommon and affects only 1 to 2% of adults. This is usually a more severe type of depression than the other type, non-melancholic depression, and has a more distinct genetic and biological basis. Someone who is predisposed to melancholic depression might have an episode of depression triggered by a stressful life event, e.g. a death in the family, but this is not usually the primary cause of their depression. Non-melancholic depression is the most common form of PND and is linked more to psychosocial risk factors than to genetic and biological causes.